LaPean, president of the Wisconsin Dental Hygiene Association. I've been practicing dental hygiene for 15 years. 14 of those have been at Glacier Dental in Oshkosh, a private practice. I'm recording this video in reference to Bill SB 392 and AB 402. I am aware that there is a proposed EFDA bill that includes suprascaling for assistance. I'd like to provide some education today. For demonstration, I applied what would be equivalent to buildup on a tooth. And EFDA, as proposed for suprascaling, would use a razor sharp instrument with a pointed tip, very similar, just like this. And what they would be doing is removing buildup from above the gum line. And they would go through and remove what they can visibly see with their eye. So before an assistant would be able to do this, a dentist would actually need to come into the room first and make a recommendation of what treatment they want provided that day. The EFDA would go through and provide this level of care. A doctor would then need to come back in at the end of the appointment to check to make sure that the care was provided accurately. This actually creates a bottleneck of a time for a dentist to come in and state what needs to be done and come back and recheck it. This is not access to care. It actually creates a bottleneck and slows down treatment. My other concern is when that dentist would come in, all the buildup would be removed that they can visibly see. They would actually have to take the time to go through by hand and re-feel underneath the gums to see if any buildup was still remaining for further treatment another day. My next concern is when that EFDA could possibly be using something razor sharp like this. They're supposed to be saying above the gum line, supra. It is extremely easy to sneak underneath the gums just while trying to get off that buildup right at the gum line. This razor sharp tip, it takes very little effort for that to come out and snag the gums. That would cause harm to a patient. It would inflict pain and it could cause damage by cutting into the gum tissue. And EFDA, it is not enough education at 70 hours to learn how to use this instrument along with many other procedures in the bill. And it also is not access to care. It's creating a bottleneck within the dentist's flow.